Good morning. This is Dr. Abhishek Mishra, and today we are going to learn about blood pressure assessment. In today's lecture, we'll be learning about the basic knowledge about blood pressure. That is, what is the definition of blood pressure and what is the normal values of blood pressure in different population, and then the techniques that are employed to assess the blood pressure. So coming to the definition of blood pressure is defined as the lateral pressure exerted by the blood on elastic walls of the arteries. It fluctuates during systole and diastole of the heart. So blood pressure is nothing but the lateral pressure which is exerted by the blood on the walls of the arteries. It is a lateral pressure exerted by the blood on the walls of the arteries, and it fluctuates during the systole and the diastole of the cardiac cycle. Now, what is systolic blood pressure? It is defined as the maximum pressure produced during the cardiac cycle. Systolic pressure is recorded during systole. It mainly depends on the cardiac output of the individual. The systolic blood pressure, it increases in condition in which cardiac output increases. All right. Coming to diastolic blood pressure, it is defined as the minimum pressure recorded during cardiac cycle. It is recorded during the diastole phase. It depends mainly on the peripheral resistance of the vessels. All right. Peripheral resistance depends mainly on the diameter of the blood vessels and viscosity of the blood. So, diastolic blood pressure will fluctuate or change in conditions where the diameter of the blood pressure or the viscosity of the blood pressure changes. Okay. Now, there are two different ways in which we can measure blood pressure. That is, one is casual blood pressure. It is measured at any time of the day. The blood pressure measured at any point of the day is called casual blood pressure. And basal blood pressure recorded under basal condition is called as basal blood pressure. Now, this basal blood pressure, it is recorded following complete physical and mental rest for 12 hours of fasting. That means morning, once you get up, immediately 10 to 15 minutes after waking up, the blood pressure that we record is called as basal blood pressure. Or else, if a patient comes to you, you make the patient rest without doing any physical activity for at least 5 to 10 minutes, and then you take the blood pressure. That could be referred as basal blood pressure. Now, according to the guidelines, normal systolic and diastolic blood pressure range is normal is less than 120 mmHg for systolic, and diastolic it is less than 80 mmHg. Pre-hypertensive or people who are on the verge of developing hypertension is 120 to 139 for systolic and 80 to 89 for diastolic. Hypertensive is 140 to 179 mmHg systolic and 90 to 109 diastolic. And medical emergency or hypertensive crisis would be when systolic is more than 180 and diastolic is more than 110. This is for adult population. Now, normal values of blood pressure for newborn from 6 to 9 years would be 90 systolic, 55 diastolic. Newborn would be 75 systolic, 55 diastolic. 10 to 15 years would be 100 systolic, 65 diastolic. 16 to 18 would be 118 by 76. That is 118 systolic, 76 diastolic. Adult would be 119 by 78 systolic and diastolic respectively. Now, there are various methods by which we can measure blood pressure. One is direct invasive method, which is required in more critical patients where you need to continuously monitor the patient with very much accuracy. Patients admitted to the ICUs, okay? Such patients would require continuous monitoring without much variance. So in such patients, we can apply direct or invasive method. The other method is indirect method, in that we have three techniques. One is palpatory, oscillatory, and auscultatory. So we'll see one by one what are these methods. Invasive method first. This technique involves direct measurement of arterial pressure by inserting a catheter. Okay. Invasive blood pressure monitoring is commonly used technique in ICUs and in OTs. Okay. So a catheter is inserted in the body of the patient and blood pressure is directly assessed from the artery. Right? The components will involve an arterial line, pressure bag, and the monitor to display the blood pressure. Now, for indirect blood pressure measurement, okay, we employ a method called sphygmomanometry. Okay, in this method, arterial wall is obliterated artificially by obstructing blood flow temporarily. So, what we do, we apply external pressure to occlude or the obliterate the pressure of the artery externally and then obstruct its blood flow. Then we gradually release the pressure, and as the sound is produced by the entry of the blood into the vessel, it is recorded. Okay, and we record it through three techniques, but that is palpatory, oscillatory, and auscultatory. Okay, now oscillatory is an old method and we do not use it anymore. We mainly use palpatory and auscultatory, and we always combine palpatory and auscultatory. Reason being the 5 stages of Korotkov sound. So if we do not, we'll see that why it is important to always combine palpatory and auscultatory methods together. Now, coming to the instruments that are required for indirect blood pressure measurement, we require two equipments. One is sphygmomanometer, the other is stethoscope. Okay. Now, sphygmomanometer, it is the instrument used for measuring the pressure that blood exerts against the walls of the artery. Its components are manometer, inflatable rubber bladder, cuff, and bulb. Okay, and there are different sizes of the cuff for different population and different build of the patient, and using correct size is critical, and that will ensure a more accurate blood pressure reading in the patient. Now, if you see the parts, this is the cuff. All right, this is the gauge, the manometer, this is the bulb, valve, and the tube. Okay, cuff, it is wrapped around your upper arm. Gauge, it records the blood pressure reading. Bulb, it inflates the cuff to stop the blood flow in your artery. Valve, a valve lets some air out of the cuff, which allows blood to start flowing again into the vessels. And tube, it connects bulb to the rubber bladder, these black tubes. All right. Now, these are different sizes that are available for infant, child, adult, large adult, or for thigh. For adult individuals, where we cannot use any injury to the upper extremities, then in such cases, we apply the cuff to the thigh and we measure blood pressure. So for that, we have cuffs available for the thigh as well. This is a stethoscope. Now, the stethoscope is a diagnostic instrument that amplifies the sound. We all know that. It is used to detect the sounds produced by the blood pressure in this correct technique, as well as heart and other internal organs such as stomach. Now, these are the parts. This is binaural ear tips, latex free. This is tubing. Okay. And this is the chest piece. Okay. This is called the diaphragm. This is called the bell. Okay, these are the common sites of blood pressure assessment: radial artery, brachial artery, dorsalis artery, popliteal artery. Okay. Types of sphygmomanometer: mercury, aneroid, and electronic or digital. There are 3 types of sphygmomanometer that are available. This is how a mercury sphygmomanometer looks like. It contains a mercury column that rises as the pressure bulb is squeezed and the rubber bladder is inflated while measuring the blood pressure. This is electronic. It provides a digital readout on a lighted display. As you can see here, it is easy to use and does not require a stethoscope. Assessment, what are the steps that are involved in blood pressure assessment? First, perform hand hygiene. Assemble all the equipments that are needed. Ensure that patient is relaxed before obtaining a blood pressure reading. So as I mentioned earlier, make sure that patient is relaxed at least for 5 minutes before you start recording the blood pressure. Greet the patient, okay, and explain the procedure. What are you going to do? How are you going to do? And what your patient is going to feel. Ask the patient if he or she has a history of hypertension and if the patient is aware of his or her normal BP reading. So patients who are hypertensive, we must ask them their history. Now, assist the patient to get into a comfortable position. It could be either sitting or lying down position, but you have to make sure that the patient's arm should be at the heart level. The patient should be reminded not to cross their legs or talk during the procedure. So you must give this instruction clearly to the patient that the patient should not talk or cross their legs during the blood pressure assessment. Uncover the patient's arm 5 inches above the elbow. Okay. And you have to make sure that the patient is not wearing any tight clothing. Okay. If you just roll over the sleeves, it should not happen such that the rolled over sleeve should not apply too much of pressure on the upper arm. Locate the brachial artery within the cuboidal space and palpate with your fingers. By palpating with your fingers, have the patient straighten the arm with palm up and apply the proper size of the cuff of the sphygmomanometer over the brachial artery, and the site would be 1 to 2 inches above the cubital space. All right. So the patient will be in supine position. The arm will be extended. You will apply the proper size of the cuff 1 to 2 inches above the cubital space. With the fingertip of your non-dominant hand, palpate the radial artery. Then with your dominant hand, tighten the thumb screw on the hand bulb and pump air into the cuff quickly. Pump 20 to 30 mmHg above the point at which radial pulse is no longer palpable. So you feel the pulse, that is palpatory method radial pulse, and the point where the pressure where you stop feeling the radial pulse, you must pump 20 to 30 mmHg more than that. Okay. And you have to record. You must know at what point you stop feeling the radial pulse. Make a note of it. Then rapidly deflate the cuff and wait for 30 seconds. Now you start the auscultation. Place the earpieces in your ears, okay, of the stethoscope and diaphragm of the stethoscope over the area of pulsating brachial artery. Okay. Now you know at what point your radial pulse stopped. Okay. So close the thumb screw and pump the cuff to the point where radial artery is no longer palpable. Okay. Slowly turn the thumb screw, allowing the pressure reading to slowly and evenly fall 2 to 3 mmHg at a time. And you have to make sure that till where you have to increase the pressure, that is 20 to 30 mmHg more than where you where you stop feeling the radial pulse. Okay. Listen for the point at which the first bump sound is heard. So when you start deflating, start releasing the air by using the thumb screw, okay, the first point or your systolic blood pressure will be where you first hear the bump sound. Okay, take a note where this occurred on the manometer. This is your systolic blood pressure. Okay, then continue deflating the cuff. The sound will change from loud to murmur and then fade away. Okay, take a note where no sound or bump is heard. The point where the sound stops, okay, that will be your diastolic blood pressure. You have to make a note of it. So the point where the sound appears first, that will be the systolic blood pressure, and the point at which the sound again disappears, that will be your diastolic blood pressure. All right. Now, once you have heard, you have noted the sound disappear, quickly open the thumb screw all the way to release the air and deflate the cuff. Completely remove the cuff from the patient's arm. All right. Clean the earpiece and the diaphragm or the bell of the stethoscope with an alcohol wipe. Okay. Perform hand hygiene. Document the patient's blood pressure as a fraction into the patient's record. Okay. Making note of which arm was used and the patient's position. Where that means whether the patient was sitting or supine. Okay. And which arm was used. All right. This is how we do. Okay, in the pressure cuff pressure inflated, you inflate, then you slowly start deflating. You inflate 20 to 30 mmHg where you start feeling the radial pulse. Then you apply the stethoscope. Okay. Then you start deflating. The point where you hear the first sound will be a systolic blood pressure, and the point where you hear that sound disappear, okay, will be your diastolic blood pressure. All right. So we saw the definition of blood pressure. That is, it is a lateral pressure exerted on the walls of the arteries. Okay. And then we have systolic pressure and the diastolic pressure during the systolic and the diastolic phase of the cardiac cycle. And then various techniques, direct and indirect method. Direct method is employed mainly in the ICUs to get a more accurate and continuous values. Okay. And then indirect method, we have three methods, that is palpatory, oscillatory, and auscultatory. Oscillatory is almost obsolete. We do not use it anymore. We mainly use palpatory and auscultatory. And always we combine palpatory and the auscultatory methods to maintain the accuracy. First, we palpate, measure the blood pressure using palpatory method. Through this method, we can measure only the systolic blood pressure. And then we use the auscultatory method using a stethoscope through which we can measure both systolic and diastolic blood pressure. Okay. All right. We'll stop here.